So what triggers in life often occur to cause irritable bowel syndrome or the worsening or aggravating IBS symptoms? These frequently are any major stressor, a good or a bad stressor, loss of a loved one, a motor vehicle accident, getting divorced, getting married, surgery, having surgery, especially gallbladder surgery and hysterectomy, probably because they're the most common surgeries. Frequently, we have people come to us who have noticed a change in their bowel movements. They're having abdominal discomfort. They're having gas and bloating after these surgeries. And they've gone to the surgeon. They've gone to their doctor. And it's just felt to be a post-surgical transition that your body's making after the gallbladder surgery, and you're going to be fine, and it's just going to last a little while. And maybe it's related to the fact that the gallbladder's not there anymore. You don't usually get too much guidance from the surgeon in this area because they've pretty much done what they were going to do in the first place, which was remove the gallbladder. And so we end up seeing a lot of these people. And again, it's not clear why they may develop an IBS-like picture, but they do seem to respond very nicely to being treated for IBS in a classical fashion. So secondary, financial stress, of course. Secondarily, patients frequently who live with constant IBS symptoms may suffer from anxiety or depression. And this is unfortunately very common. And anxiety and depression act as positive feedback mechanisms back to the IBS to make it worse. So frequently, so many people end up being in a circuitous positive feedback loop. And I'll show you what that looks like here in just a moment. I tried to put a little chart together to kind of illustrate this. Here's your irritable bowel syndrome. And of course, IBS can cause gas and bloating, irregular bowel movements, loose bowel movements, hard bowel movements, or alternating between loose and more formed bowel movements. IBS can cause chronic pain that's there all the time, or just episodic or acute pain. Sleep disorder is frequent, and we'll talk more about that associated with IBS. And I meant to put down here as well, chronic fatigue is also goes along with IBS. Now, if you're someone who's suffering from some of these or all of these on a regular basis, what's going to happen is depression, anxiety, and stress are going to occur as a result of you living with these symptoms that may not be controlled successfully. There's your chronic fatigue. And all of these will feed back positively on the IBS again. So you're getting caught up in this positive feedback loop. And so, and if you look at just depression, anxiety, or stress alone, sometimes these can be triggers of an IBS picture. And so again, the goal of therapy is, in my mind, is to try to not only try to address these individual symptoms, but you have to address and treat successfully any depression, anxiety, and of course, as difficult as it may be, to remove some of the stressors in life. IBS can be mild, moderate, or severe in nature with regard to symptoms, and is usually of three types: a diarrhea predominant, constipation predominant, or diarrhea alternating with constipation pattern. And in the severe forms, again, anxiety, depression, insomnia seem to play a much more of a significant or major role. To help the physician make a diagnosis of IBS, the Rome criteria, R-O-M-E, were established by a group of doctors. And they've been modified over the years, but basically state that if you have a sudden change in your bowel movements, again, the pattern, diarrhea, constipation, or alternating, loose and more formed, associated with abdominal pain, cramping, burning, sharp stabbing pains. So again, with those symptoms which may be exacerbated or worsened after a meal or a stress event, possibly abdominal discomfort that gets relieved after a bowel movement, in addition to maybe a sense of incomplete evacuation where you go to the bathroom, you have a bowel movement, you're finished, you walk out, and soon after you feel like you have to go back. You feel a sense of incomplete evacuation. Those symptoms with a negative GI workup, classically including a colonoscopy, basic blood tests, most likely, if you have reached that particular point, you have irritable bowel syndrome. And I think most of our patients that we see end up in that scenario. Another very important thing not to do when the diagnosis of irritable bowel syndrome is made is to panic, because this is only going to worsen, in many cases, the irritable bowel syndrome symptoms. Remember, stress and anxiety and depression, as well as lack of adequate sleep, can make the IBS symptoms worse or more difficult to treat, less responsive to the usual medications. This is, again, where acceptance comes in. What do you mean I only have a functional, what does functional mean? A motility issue of the intestine. It's just not working right. It's not a disease process.